Hi folks, my name is Dr. Aubry and I'm a board certified chiropractic physician and a board eligible chiropractic neurologist. I trained under Dr. Ted Carrick, who's the world's foremost authority in chiropractic neurology. He was most recently in the news because he was the doctor who treated the NHL's Sidney Crosby and got him back on the ice after he had a severe concussion. Now, I interact daily with a group of over 1,000 doctors throughout the country focusing on functional neurology, or what we call brain-based therapy. Now, this group, known as the Johnson Neurometabolic Supergroup, can be viewed by going to www.lifechangingcare.com, where you can see testimonials from across the country. Today, you're watching this video because you or someone you love is suffering from chronic headaches or migraines. Well, in our office we do things differently, because we treat you neurologically and metabolically. We leave no stone unturned. Now, most likely you've seen other doctors about these migraines and have not had any long-term success. If you have, you might have had an MRI or a CT scan and the doctor said that they were negative for tumors or strokes or other pathologies. Then you might be suffering from what we call soft lesions. Now, what's a soft lesion? What is that? Well, a hard lesion is something like a tumor or a pathological process like a stroke. On the other hand, a soft lesion is when there's an area of your brain that is not functioning at 100%. But the good news is it can be isolated and rehabilitated or changed. Now, these soft lesions are brought about by your lifestyle and stress. Well, what kinds of stress? Stress comes in different forms. You have emotional stress. If you've ever gone through a divorce or bankruptcy or had a severe loss or dealt with money issues, that's emotional stress. You might have had physical stress like a car accident or a sports injury, or chemical stress, just the daily eating of junk food. I mean, so many people are eating junk food or smoking or doing drugs. All of these things are chemical stresses that are put on your body. Well, why is that important? Well, because stress is going to cause the nerves to slow down or decrease in what we call their frequency of firing. So what that does is it leads to a soft lesion. So how do we determine this? Well, first of all, we're going to do certain kinds of lab work. We're going to do blood work. Now, you may have probably had blood work in the past and everything was fine, but what we're going to be looking at is we're looking at functional ranges as opposed to a pathological range. Well, you might ask, what's the difference? How come my doctor never mentioned this before? Well, let's look at the thyroid as an example. Now, when we look at lab ranges for what we call thyroid stimulating hormone, or TSH, now normal is between 0.5 and 5. The optimal range is between 1.8 and 3. So you could be at 1.2 and be normal, but functionally your thyroid is hypo or underworking. Now, what we're going to do is we're going to order blood tests. We're going to order these blood tests for your thyroid. We're going to do a complete metabolic panel. We're going to do what's called a CBC with an auto differential. We're going to look at your lipids, or lipid panel. And we're going to look at your red blood cells. Why is that important? Because those are the cells that carry oxygen. And we're going to look at your white blood cells, which deals with your immune system. The next thing we're going to do is sensitivity testing. And the reason why this is important is because we're going to see if you're sensitive to certain foods, like milk, soy, yeast, and or gluten. If you are, then you might have had some of the following symptoms: chronic pain, bloating after eating, mouth ulcers, indigestion, constipation. Do these sound like things you might have been experiencing? Well, the next thing we're going to do is an adrenal stress test. We're also going to check your body's blood glucose levels and your immune panels for what's called Th1 and Th2. Are you autoimmune? Is there something else going on there? And when we look at women with chronic migraines or headaches, we're going to check C-reactive protein and homocysteine levels, and we're going to see if it's elevated and if there's any indication of inflammation. Then what? Well, what we're going to do is we're going to address it with the proper nutraceuticals and vitamins and possibly glutathione. What's glutathione? Well, it's probably the most powerful antioxidant that we have. Next, what we're going to do is we're going to address the neurological components. And what are we going to do? Well, we may use something like oxygen therapy. Why would we use oxygen? Well, your brain needs two things to survive: fuel and activation. Now, fuel comes in the form of glucose, or sugar, and oxygen. Now, when we hit age 25, every year after that, we lose 1% of our ability to utilize oxygen. This is called oxidative phosphorylation. So when oxygen is decreased to our tissues, it causes ischemia and vasodilation, and then that leads to pain. So when we give somebody oxygen, which is generally 90%, it's not 100% like you get from a canister, but this is from an oxygen concentrator, so it's very safe, 90% oxygen from an oxygen concentrator, and we combine it with exercise, it's a very powerful way to treat the affected areas of the brain. So what oxygen is going to do is it's going to prevent reflex vasospasm, and that's going to prevent pain. So we will do a full neurological evaluation. We're going to treat you functionally, and this is what we call functional neurology, or brain-based therapy. A lot of times when we see things like headaches, we start to see problems in the brainstem or the cerebellum. The brainstem is made up of an upper, middle, and lower brainstem. Now, normally the brainstem fires or sends signals to the lower brainstem. The lower brainstem fires to the upper brainstem, and what we call this is the neocortical hypothalamic pontomedullary reticular activating system. Now, if this link is interrupted, then the upper brainstem is going to overfire. What this does is it can do things like cause the eyes to dilate. So you become sensitive to light. That's why you get the light sensitivity with headaches and migraines. Now, what about the pain? Well, the brain itself does not have any receptors for pain. So the cause of a headache, the cause of the pain from a headache, is from dilating vasculature, what we call post-stenotic vascular dilation, as they actually get bigger. This causes a depolarization of what we call nociceptors in the perivascular plexus around the blood vessels. What does that mean? Well, around the blood vessels you have pain receptors called nociceptors, and in the vascular plexus, or the mesh that actually surrounds the blood vessels. So the blood vessels stretch, and that causes a discharge in the stretch receptors, and then you perceive the pain in certain areas of your body, specifically in the head and neck, or what we call a trigeminal or upper cervical distribution. Now, the sensitive structures to pain are the scalp blood supply, the head and neck muscles, the venous sinus, arteries of the meninges, the large cerebral arteries, and our cranial nerves 5, 9, and 10, and also parts of the dura mater at the base of the brain. So what are we going to do? How are we going to get you better? Well, there's going to be lifestyle changes. There's going to be changes to your diet. So if you're not prepared to do this, please do not waste your time, do not waste your money with this recovery program. But if you're ready, if you're serious, then what we're going to be doing is we're going to be treating you metabolically and neurologically. If what you've seen here makes sense to you, then please book an appointment. Now, a lot of you may ask, does my insurance cover this? Well, it may cover a portion of it, but we also offer financing options. So even if your insurance doesn't cover all of it, we're still going to be able to work with you. The most important thing is, are you ready to make a change? Now, we're going to be testing, we're going to be treating you, and we're going to be retesting you throughout this program. It may take 6 months, it may take 12 months. This is a chronic condition, and this didn't just happen overnight. You've been suffering for this for a long time, so it may take some time to make some changes. So what I have to ask you is the following. How has this affected your life? Now, what is your life worth to you and your loved ones? Is it worth $2,000, $5,000, $10,000? Where do you see yourself in 3 to 5 years? Well, what's going to happen if you don't make a change? How is your life going to be if you don't change this? Are you committed to getting better? Now, this takes work. Once again, I want to make sure that you know that we're affiliated with Dr. Michael Johnson at lifechangingcare.com. So you can go back to that website at www.lifechangingcare.com and check out some of the testimonials right there from patients who are treated for chronic migraines throughout the country, and tons of them are getting better. When you're ready, give us a call. Area code 802-893-1070 to book an appointment. And once again, my name is Dr. Aubry Tager, and I'm willing to do whatever it takes to help you get your body better. Are you? Thank you.